Case 12, presented by Ashley Anderson, Mariah Verdon, Megan Traxler, and Seth Johnson.
In our case, an individual with the initials JL came to the pharmacy explaining that he is experiencing pain and discomfort when using his insulin pens and is seeking advice.
JL is a 17-year-old male with type 1 diabetes and was diagnosed 2 months ago. He came into the pharmacy with his mother. He has no known drug allergies, and the social drug use is unknown. He states that he is feeling pain and discomfort when injecting his insulin. He states he does not have blood sugar levels below 70 milligrams per deciliter and has no signs or symptoms of hypoglycemia. JL states he stores his insulin in the refrigerator at all times, before and after injection. He states he injects on the right side of his abdominal area, 2 inches from his belly button, and 2 inches from any moles or scars, and does not use any other body area for injection. He states he wants to keep the absorption consistent.
Today, JL has no known drug allergies. Alerts are unknown at this time, as are immunizations. Both of these will be assessed at future follow-ups. Treating his diabetes, he currently takes Lantus SoloStar pens, which he injects 18 units subcutaneously once daily at bedtime. And additionally, he uses Humalog QuickPen, which he injects 6 units subcutaneously 15 to 30 minutes prior to meals 3 times a day. Both of these he began about 2 months ago. He stated that he does not rotate his injection sites, and his insulin is stored in the fridge both before and after use.
For information, the patient is a 17-year-old male with type 1 diabetes and was diagnosed 2 months ago.
Now that we have collected all the background information, we are going to move into the assessment portion.
JL has the condition of type 1 diabetes. Type 1 diabetes is when the patient can't produce enough insulin.
During our assessment, we determined that JL had 2 drug therapy problems that each required a short and long-term goal of therapy. In terms of improper storage of the insulin pens, our short-term goal of therapy was to eliminate JL's injection pain and discomfort associated with improper storage of his insulin pens within 1 day. The long-term goal was to prevent JL's injection pain and discomfort associated with improper storage of his insulin pens indefinitely. Regarding the drug therapy problem of improper technique, our short-term goal of therapy was to eliminate JL's injection pain and discomfort associated with improper injection technique within 1 day, and our long-term goal of therapy was to prevent JL's injection pain and discomfort associated with improper injection technique indefinitely.
Our therapy problems fell under the category of adherence and compliance. Our first therapy problem we identified was that JL is experiencing pain and discomfort when using his Lantus SoloStar insulin pen and Humalog QuickPen because he is not rotating injection sites. Our second therapy problem was that JL is experiencing pain and discomfort when using his Lantus SoloStar insulin pen and Humalog QuickPen because he is storing his open pens in the refrigerator.
Case, we had 2 therapeutic options for JL. The first one is the utilization of the injection diagram. This can help JL better understand how to rotate injection sites and other injection sites that are available to him so as to decrease the pain and discomfort at the injection site. The second therapeutic option is patient education on insulin storage. Once an insulin pen is opened, it can be stored outside of the refrigerator for up to 28 days. Additionally, cold insulin may be adding to his discomfort at the injection site.
So after our collection and assessment, we have determined a plan to implement for JL's drug therapy problems.
When updating JL's med list, we determined that the insulin itself seems to be effective for him. He has not noticed any signs of hypoglycemia and has not had any incidents of low blood sugar. Therefore, we determined that the insulin itself is not the problem in this situation. We decided to keep the Lantus dose the same at 18 units subcutaneously once daily at bedtime. Additionally, we kept the Humalog at 6 units subcutaneously 15 to 30 minutes prior to meals 3 times daily. The only changes that we are implementing was the rotation of injection sites and the storage of the insulin pen. Once he opens the insulin pen, it should be taken out of the fridge.
In addition to the changes we discussed previously, some other interventions we decided were appropriate would be to educate JL not to use pens past their expiration date. For both package inserts for Lantus and Humalog, the expiration date after first use is 28 days. Unused pens should be kept in the refrigerator until they are opened or reach their expiration date. We also will educate JL to utilize a pain journal on a scale of 1 to 10, with 1 being no pain and 10 being unbearable pain, documented for every injection he gives himself, which would be 4 a day. We would also educate him that the absorption will still be the same even if he rotates injection sites. If he does end up using the same injection site, he could end up with fat deposits under his skin that will cause hard lumps known as lipodystrophy. For our follow-up evaluation for JL, we will be assessing the safety and effectiveness. Based on our short-term goals, we plan on following up with JL and his mother over the phone in 1 day to determine if there's a decrease in pain and discomfort after the patient education on storage and technique for injection. What we want to do is have the patient continue monitoring for pain and discomfort at the injection site. If JL feels like his pain and discomfort has not been relieved in 1 day, we recommend that he contact his primary care provider. Additionally, we want him to monitor for buildup of fat deposits at the injection sites known as lipodystrophy. If he notices any buildup of fat deposits, we would additionally refer him to contact his primary care provider. For our long-term goals, we recommend that JL monitor for pain flare-ups in the future. If he has any increase in pain, we would have him contact the pharmacy or primary care provider. Additionally, we want to ask JL about any immunizations and alerts that were not collected earlier in the evaluation.
This concludes our evaluation of JL's case.